Is Black Maternal Health Week, and the campaign specifically addresses the high rates of preventable maternal deaths among Black women in the U.S. WHAS 11, Charlene Shanklin and Gabby DeGeorge speak to a healthcare official and a new mom about taking ownership of their health and the work to find people who have their best interests in mind.
And you have autonomy. You can come in here and say, this is what I want.
Alexis Crawford with Norton Healthcare is a hospital doula.
You don't have to feel bullied. This is not a prison. This is a hospital.
An emotional support advocate.
We want to help you, so you don't have to be afraid.
They help women through childbirth, pregnancy, postpartum, breastfeeding, anything a laboring family would need. Many believe it's only for births at home, but in Crawford's case, she calms the nerves of an expectant mother in hospitals too, and reassures them that they are in a safe place.
And I think once that stigma and that fear is kind of broken and people feel empowered when they come in, we will have more better outcome. I'm like the inside connect, right? Because I get to see them in their doctor's appointments. I get to establish the relationships with their doctors along with the families. I tell them all the time, this room is your hotel. We're going to pretend because we can make it as comfortable as we need to be.
We had the opportunity to meet Talisha Olaleyi, a first-time mom who delivered a baby girl weighing 6 pounds and 11 ounces.
Both are good. She's passing all the tests. They keep telling me how perfect she is, and that warms my heart, so we are doing well.
She explained she made the decision to leave her first doctor because they were not a good fit.
I actually moved over to the midwives and the doulas because I wanted them to be able to advocate for me because I'm learning and I was new.
She says the resources they provided, the compassion and understanding was transformative.
I'm a first-time mom and I didn't want to feel like a transaction.
It changed the whole pregnancy experience where Black maternal health was a major concern.
I feel like it's often ignored, but I'm an advocate for myself. But it was going to be hard for me to advocate because it was my first time.
Olaleyi and her husband were able to make the decision together with staff to have a C-section. Their main goal was to deliver a healthy baby.
I was in labor, as the last doctor told me during the C-section, for 55 hours. And so at the beginning, I met with the doula. She was with me the entire day.
According to the Kentucky Public Health Maternal Mortality Review, it impacts Black women at a rate of nearly 4 times greater than white women. But Crawford is working for change.
I have been down to Frankfurt. We have lobbied. I also partner with ACLU and Sister Song, which is a reproductive justice organization that I am very, very close with. And we fight these issues.
This week's theme is Rooted in Justice and Joy, shaping a liberated future rooted in justice, healing, and joy. Olaleyi is one of their success stories.
Them being there for me, the doulas and the midwives, it was transformational. Like, it really, really was.
I'm Charlene Shanklin for WHAS 11 News, on your side.
Go Red for Women support Black mothers. They say cardiovascular disease is the leading cause of maternal death in the U.S. Black women face a greater risk in developing high blood pressure, having a stroke, or developing complications during or immediately after pregnancy.